Here you go.
Okay, we're going to go over what we need to do for our infusaport checkoff. You should have this little list. It's on your Blackboard Practicum 2 in your student resources, or in your, actually it's in your IV Therapy Content Week Module 1. And I'm going to have this in front of me so that I don't mess up, and you should have it in front of you when you're practicing so that you don't mess up. So, first of all, I'm going to check my physician's orders, my institutional policy, before I do anything. So I'm going to go check all that out and make sure that my doctor's orders and my physician's, my policy tells me how and what I need to do with my patient. So then I'm going to come into my patient's room. Knock, knock, knock. Hello, Mr. Chess. My name is Janice Innos, and I'm here today to access your infusaport. Have you ever had your infusaport accessed before? Oh, you have? Well, that's great. Well, just in case, just a little bit, I'm gonna clean it, or I'm gonna be able to get all my supplies. I'm gonna clean it. And we're gonna stick you with a little needle and get ready for some chemotherapy that your doctor has ordered for you. Yes, do you have any questions about that? No? Okay. Let me make sure you're who you say you are. Okay, Mr. Chess. I'm going to go ahead and go get all my supplies. Oh, before I leave, are you allergic to anything? No? Okay, that's great. And did you sign your consent for me to be able to do this infusaport when you came in this morning? Yes? Okay, well, great. I'm going to go get my supplies and I'll be right back in. So when you go out to get your supplies, be sure that you check on your dressing change tray here, that we have inside here one mask. Well, actually I need two masks, because I need a mask and my patient needs a mask, because we have started putting masks on the patients as well. So I need to make sure I get a mask. It says I have a pair of gloves in here, so I have a pair of sterile gloves in here. I don't know what size these are, but I can guarantee you they're all wrinkly. So if I'm a little bit shaky about putting on sterile gloves and don't have a very good experience at it, I'm going to go and get a pair of sterile gloves, which we will have sterile gloves available for you. I'm going to go get those in the size that I need so that I'll have a pair of sterile gloves that I can easily put on. This has a drape in it, so I'll have a sterile field. It has a chloroprep in it, so I'll be able to clean my port site. Alcohol pad, probably won't use that, but it's in here. There's my antimicrobial disc. I'm going to need that. Don't know if I'll need tape, but it has it in here. Has my securement patch plus my dressing that I'm going to need. So it has everything in here pretty much that I need, except for it doesn't have my Huber needle. So I'm going to get what I'm calling my Huber needle, Gripper Plus needle. They're known as different things. Be sure you save this and don't throw it away, because you will have to document that it's a 19 gauge by 3/4 inch. So you want to be sure you know what size your Huber needle is when you get ready to document. I'm also going to need a pair of non-sterile gloves just in case in case I need them. So I want to be sure to take a couple pairs of those. And I'm also going to need a saline flush. Now the bad thing about my saline flush is that when I get my sterile field set up, I can't put this on my sterile field. Can you get in there where it says do not place on sterile field there? So you can plainly see I can't set that on my sterile field. If I do, then my sterile field is no longer sterile. So we have to do a little bit of manipulating to be able to use this. It would be a whole lot easier if it came in the kit, but it doesn't. So we're going to do what we need to do. And so hopefully this is all the equipment I need. And I'm going to try using the gloves inside there. All right. So, okay, no. Hey, Mr. Chest, I'm here to do your supplies, or do your infusaport access. It would be ideal if this was on a bedside table. But the reason it's going to be here is for you to be able to see what I'm going to do. You would never put this on the bed with the patient or where he's at. I'm going to make sure that he's in a sitting position. I'm going to wash my hands. I'm going to provide the privacy, pull his curtain. He's already at a good working height for me, but I have to make sure that I say that I'm gonna raise this bed to a working height or I will miss it on my checkoff. Miss Smitty will give me a bad grade. He's already sitting up, but I gotta make sure that I say that I'm gonna have him in a sitting up position. Okay, Mr. Chess, I'm gonna palpate for your port if that's okay with you, okay? So I'm going to palpate to see, make sure I can find where the port is with my fingers. And I feel the port right here. Of course, a lot of ours are used and you can kind of see where they're at, but you need to be sure that you're palpating. So, do you want any anesthetic at this time, Mr. Chess? I can put some Cream on it if you'd like. No? You've had this done a lot of times? Okay. Well, we won't do that then. All right. So I'm going to start setting up my sterile field, Mr. Smith. I'm going to put, here's your mask to put on so you don't contaminate my area, okay? All right. I know it's hard to breathe through those. I hate them too, but I'm going to be putting one on just pretty soon. I didn't need my gloves. In order to keep things as sterile as I possibly can, I'm going to open up my Huber needle and keep it in my packet. I'm going to open up my sterile saline and I'm going to leave it laying in the packet next to it. Okay. There's been a lot of controversy with everybody whether you can reach in or not reach into your sterile field. Evidently, this kit was designed that you reach into your sterile field and pull out your mask. And this is your mask, and you should wear it, and you will wear it during checkoff. I won't wear it during checkoff. I don't know, you may be able to hear me okay. So there we go. Now, here are my sterile gloves. I'm going to have to pull them out without touching anything in there. Now, am I ready to put on my sterile gloves? I don't want to be reaching over, so I want to move those up. And I'm ready to put on my sterile gloves. And like I said, these gloves are pretty wrinkly. So you want to be sure that you're confident with these gloves, or get a pair that you know will fit you. These are pretty green gloves. I think they were blue last year. No, they were pale white. Actually, these are easier to put on than what they've been. Yay. Alright, so far I've not broken sterile field. Okie dokie. So I've set up my sterile field. I have everything ready that I need to have ready. Okay, Mr. Chess, we are going to have you turn your head away, and I'm going to clean your site. My hands are sterile. I can reach in here and get rid of stuff I don't want. I probably won't need this pad. I want to go ahead and open up my vial patch. Vial patches are hard to open up with gloves on. And you got to be real careful with them or they'll go flying out to you know where. But since you're sterile, you can touch it and drop it in there. Get rid of that. I don't see any use for this. I'm going to get rid of that. And there is all of my other stuff. So, pop it. I'm going to clean in an up and down motion for at least 30 seconds. I'm not going to saturate Mr. Smith or Mr. Chess because I don't want to have to wait for an hour for him to dry. Okay? Don't cross over your field. Bring it back over around that way, get rid of it. You don't need it anymore. Okay, no. So now I am waiting for that to dry. I'm going to get my flush and stuff ready. So now I'm going to reach my sterile hand into for my sterile Huber needle. I'm going to take off the plastic. I don't need that anymore. I'm going to take this white thing off because I don't want to use it. And when you get ready to do your check off, there's a safety feature here. When you get a real good shot of that safety feature, you pull this back with your thumb and it will snap. But while we're practicing, we're not going to do that because we're going to reuse our Huber needles. So don't snap it, but I'll show you how to do it. Okay. I'm going to take off the end of the blue end off of there. Now, this is the point where this hand is going to no longer be sterile. I'm going to pick up, I probably should have took that off since my hands aren't that strong. Come off of there. Make sure I don't have any air in my fluid. Screw it on, making sure I don't contaminate this hand. This hand is still sterile, this hand is not. Flush make sure I get all of the air out. Okay, now this hand is no longer sterile. I'm going to come over here, and I've already made a big boo-boo in that I didn't put on my patch. But since this hand is still sterile, I can still save the day by putting my patch on. If I can do it without sticking myself. Okay. Alright. So I'm going to drop this down. I'm going to triangulate my infusaport. Get it to where I need to be. I'm going to go in at a perpendicular angle, and I'm going to stick. And I have to hold on to Mr. Chest because he likes to go places. Okay. So, I'm going to have my patient perform that Valsalva maneuver before I insert the needle, which I forgot to do. So that would cost me 10 points. I'm going to aspirate for blood return. Woohoo, look at all that blood return. Yay, ha. Then I'm vigorously going to flush the line doing a push-pause method. And I don't have to be sterile anymore. Push, pause, push, pause, push, pause, push, and snap. So that I don't have any blood coming back into my infusaport. And then I'm either going to hip lock it or I'm going to hook him up to an IV fluid. I'm going to document my procedure. Now, what have I forgot to do?
Covered up.
I forgot to put my cover on. So when would I have done that? I can still do it now. I need to be very careful not to touch the sterile portion of my dressing change, or my dressing towel. Once it's covered, I don't have to worry anymore about anything. And then I have a stat lock here, or stabilizer, that I don't have to worry about being sterile free yet. I want to make sure that it comes up under okay. Now where was I supposed to put that on there? Huh, I don't have it on here. Well, yay, huh? Alright. So that's the finish of it. Make sure that you put that on there. Because you're not going to, then you go document it after you put that on there. Then you're gonna have to go in and de-access, so for the sake of time while we're doing our checkoffs, we're gonna pretend that your sterile gloves are now your clean gloves, and you've washed your hands and you've put on clean gloves. Hello, Mr. Chest, your treatment's all over. We're fixing to de-access your port. Make sure you're who you say you are. Yep, Mr. Chest, date of birth, okay. I'm gonna wash my hands and put on these gloves. Then I'm going to get